Everything we're doing is this. The vaccine is the weapon that will win the war. We know that. The vaccine is coming. There are three obstacles. Number one, the supply of the vaccine. This nation does not have enough supply of the vaccine, period. When President Biden walked into office, the cupboard was basically bare. And the federal government had not procured enough vaccination from Pfizer, Moderna, et cetera. So we have more Americans searching the vaccine than we actually have the vaccine. In New York State, 10 million people are eligible. 10 million. Nursing homes, first responders, essential workers, 65 plus. That is 10 million people. We only get 300,000 doses per week. That's the problem we now have. It's not a problem just in New York. It's a problem in every state in the nation. Not enough supply for the number of people who need the vaccine. The federal government understands it. They've been increasing the supply week to week. The president announced last week, by the end of July, there'll be enough vaccines for all Americans. And that's great news. We still have to get from today until the end of July, but at least the end is in sight. That's the first issue, is the supply. The second is making the vaccine accessible, and making it accessible in an equitable way. This is the truth about COVID. COVID discriminates. COVID highlighted the injustice and racism in society. It's not a pleasant statement, but it is a true statement. I say that COVID created low tide in America. You know, at high tide, when the water's up, everything looks nice, because all you see is the surface of the water. Low tide, the water goes down, and then you see all the ugliness that was on the bottom. It didn't create the ugliness, but it showed the ugliness. Low tide in America, COVID showed you the racism, the inequality, the injustice that was just below the surface. Under COVID, blacks died at twice the rate of whites. Just think about that for a second. Blacks died at twice the rate of whites. Hispanics died at 1.5 times the rate of whites. How shameful. Why? Because blacks, Hispanics, poor communities did not have the same health service. They had more pre-existing conditions. They had higher infection rates of COVID, but less testing. So now we get to the vaccine for COVID. And what we're saying as a state is we have to be equitable in the administration of the vaccine, and we have to correct for the injustice that we just saw perpetrated by COVID. That's right. You have to correct for the fact that twice as many blacks died. You have to correct for the fact that 1.5 times as many Hispanics died. And you have to get the vaccine to the community where they are. And that's what this is all about. Now, not only is this the largest site ever created in the